All right, everyone, welcome to our third podcast. Today I have my dear friends and senior nurse anesthesia residents here, Cameron Hershey and Kaylin Vandermeel. They are my seniors, but I also call them my mentors, friends, and I go to them for any advice that I need throughout the nurse anesthesia program. Today, a lot of people have reached out about different avenues to reach to nurse anesthesia school and become a CRNA. One thing which is very unique about the school that I go to is that we also accept flight nursing experience, right? The emergency flight nursing experience. We'll have two flight nursing here. So if you guys want to introduce yourself, very quick, short, and then we'll jump right into this conversation. Cameron or Caitlin, either one.
My name's Cameron Hershey. Great introduction. Thank you so much. But yeah, I was a ER nurse, then a flight nurse, and then concurrently an ICU nurse as well.
Yep. My name's Caitlin Vandermeel. I've been a nurse for 9 years, background in ER, ground transport, flight, ICU.
So, question, like you guys mentioned, you have been experienced nurses for like a hot minute, I would say.
Just a
The
short
back
while.
of your mind, at the back of your mind, when you started nursing, was there ever any thought that you would want to go and pursue CRNA, or were you like, okay, I'm gonna do this really cool thing called flight nursing, and then later on, when you discovered more stuff, and then you stumbled upon this.
For me, I originally knew I wanted to do nurse anesthesia. I just, in the beginning when I was a baby nurse, didn't think I would ever get there. And my second was flight nursing.
Uh, I went. Apparently, when I was a child, I wanted to be a flight nurse, but I didn't know what it was. But I drew pictures of it. Apparently, I was shown lately. But I actually went into nursing to do CRNA, even though I had no idea what it was. Um, my dad told me they just made money, so I was like, sure. Um, but it's funny. My whole plan was to do ICU immediately, like a lot of people's are, and then go straight to CRNA. So, when I graduated nursing school, I applied for some ICUs and I got an interview with one and went through a whole shadowing thing with it. And I was like on track and I actually didn't get the job. And I actually I was pissed. Like I was so angry because that was like my whole plan. And I called them and was like, why? Why didn't I get? Because my friend got it instead, actually. And I was like, screw her. Like, why'd she get this job? Because we both shot at the same time. And they're like, hey, we're giving her the job, not you.
It wasn't meant
Uh,
for us.
and one, they were very surprised that I called them. And two, they're like, honestly, it's they're like, you are not gonna be a good ICU nurse. They like straight up told me that. Like, we're like, hey, like, this is not for you. Like, they're
Way,
like, I don't,
way to, way to crush your dreams, man. Who
dude.
says
And
that?
I hadn't even been a nurse yet.
Out, but it worked
Yeah.
out.
Well, at the time though, like they told me that, and they're like, your personality is not well suited for the ICU environment. And you know how ICU nurses are; they're on their high horse a lot. So of course, this nurse manager was like, just reaming me, like, you're not, we didn't like the way your attitude was and the way that you were laxy daisy about certain things, and blah blah blah. And I hadn't even been a nurse yet, so I was like, whatever, you don't know me, like screw you, and I like hung up the phone. Um, and so I took my second job, which was a ER. I didn't want ER. I didn't even want to go into the ER, but it was my fallback. So
Yeah. I was not a great student when I was first like coming out of nursing. So I thought that that really bit me in the foot to like start out trying to do nurse anesthesia. So I didn't go that route. I just kept my associates in nursing, went right to the ER, um, really like worked that for a few years. And then I did travel nursing for a while, and I did one of my contracts. They did ground critical care transports for the nurses. So that was like my first taste of being independent. And yeah, that kind of just grew from there. And then that's when, the independence kept growing and I wanted more and more. And that's when I went down to flight nursing.
I would like to, I would like to fight that. Caitlin and I think Cam can also speak for that, but I don't think you were not a good student because I've seen you.
I have the GPA to prove it. It was really
So
bad. So I
we
actually
both are
got
in that boat.
yeah, so I
Oh,
actually failed out of nursing school the first time I ever attempted to, like, I went to a big university, but I was 17 when I graduated high school. So I was young and dumb and didn't really appreciate school and had to basically do everything over again. And that was really hard. So that kind of like shook my confidence and like, but like I said, I did a few years in the ER, did like that the travel assignments, did some ground critical care work, and then I was like, okay, like I can at least do this independent thing. Like I want to see what I get with more autonomy, and that's why I went down that like and I knew I was always meant for the ER. I didn't feel like I was connected to like the ICU environment. So that's definitely even more why I went towards flight nursing because I'm like I can get the autonomy, I can get the adrenaline. Like I know that that's meant for me. So, and then once I did that, once I did a few years of flight nursing, I was like, okay, I can definitely at least try to apply to CRNA school. I can retake some classes, do my bachelor's. I got into a level 1 surgical trauma ICU. So I worked that full time, flight full time, was doing my my BSN. So don't recommend. But it worked out.
Gotta grind.
Yeah.
so if I
Yeah,
can,
it's
if I can
doable,
ask
right? Like just because you screw up, it's
Yeah,
still
it's doable. I had
you,
my GPA when I failed out of nursing school that first time. I think it was like a 1 point something stupid. Um, yeah. So, and I think once I graduated and got my bachelor's and did a couple of sciences, I ended up, I think my science GPA just made a 3.0, but like my last 60 hours and my BSN GPA were really high. I think it was like a 3.8.
so you would you say like the amount of time that you took as an experience, to gain experience as a flight nurse prepared you for CRNA school? Like, did you guys do a lot of, were you in this situations where you had to be there when there was emergent intubations? Did you guys get to intubate anyone? Like,
Oh
were you
yeah.
Oh,
trained
hell
to do
yeah.
that?
That's it's and Caitlin will attest to this because we both worked at different companies, right? So she was in a different part of the U.S. I was in another part doing flight nursing. It's just like any part of nursing or medicine in the nation, things differ quite a bit demographically depending on where you're at. Um, you know, coming from the ER, I didn't want ER, but I learned to love it, and that's why so many years, 7 years of nursing passed until I finally applied to CRNA school. One, because my grades were horrible. I went to an undergrad in human physiology, did horrible because I didn't know what I wanted to do. Partied, and I was 17 as
Yeah.
well. Got an accelerated bachelor's in nursing, and then went on. But so part of it was me thinking I wouldn't get in, and kind of scared to even apply. And then so I thought, well, the only way to make myself competitive if I do want to do this is to get a ton of amazing experience. And once I was in the ER, I loved the chaos and I kind of just was having fun. I'll be honest, like I enjoyed it. I worked at a level 1 trauma that was like very high acuity, and I stayed there for a few years. And then I did the travel nurse thing, and I just yearned for more autonomy. So when I started flight
I'm the
nursing,
same.
yeah, we basically have the exact same background, similar, like it's very similar. We're both screw ups and we both are dirty ER people. Like, but we made it work and it wasn't
We did.
easy. But it's funny. I applied to a few anesthesia schools, and most of them either don't take or consider flight nursing,
That's true.
and even the ones who would slightly consider it or like we're willing to hear you out do not understand the job whatsoever and don't like
Yeah.
I had one straight up tell me, hey, like I just don't see how this translates to
There's
what
a
you
big gap. There's a big gap in knowledge and education in that.
yeah, I mean, one of them literally told me that they're like, we just don't see how this your flight nursing experience will translate, and I
Which
honestly
is which is
laughed.
funny because we do like not only is our job like 911 response, but it's also like hospital transfers. So a lot of times you're doing ICU to ICU. So like
Well, in
they
newsflash, most of anesthesia, most of it, you're not dealing with ICU level patients. You might be, but most of the time, these patients are optimized. They're outpatient. These are not always the sickest of the sick. They can be. There are times that is the case. And I understand that you need to have those skills from the ICU were titrating vasopressors or hemodynamic stability. But in flight nursing, you do that. You transfer ICU to ICU all the time, patients on ventilators, and there is no respiratory therapist with you. There is no physician with you. There's nobody giving you orders. You
You
have
have to be
you have a
able to,
booklet that's about 500 pages of
yeah.
possibilities. We call them guidelines, and you don't have to follow them, but they're guidelines. So your autonomy level is so high. I mean, in reality, as a bedside nurse, there is no higher level of autonomy than flight nursing.
Yeah, you have to be able to do it all. You have to be able to land in the middle of nowhere with, your stick of gum and your popsicle stick and, figure stuff out with your paramedic, or, pick up and you're taking over from a physician because it's the physician's patient. So you're taking over their patient and kind of having to assess the entirety of the patient and transfer care to another hospital.
And let me tell you, some of these hospitals are not hospitals. I mean, we've showed up to some critical access hospitals that the physicians
It's a
called
four-wall scene
because
call.
they want us. I mean, we were dispatched to intubate people because the physician at this facility didn't want to or couldn't or didn't
That
want
would
to.
happen often. That's a lot of rural hospitals. I mean, sometimes in these rural places, they can have like a podiatry doctor covering, like ER or like things like that where, they don't intubate. They don't do that stuff. So they would
We've
call,
done it once in med school, and haven't done it
yeah.
since, which is fine. It's just going back to your question of, does that translate? Yeah, I think that yes. I mean, the autonomy level for sure. Um, and then, you're having to make decisions quickly, definitively, and on the fly. You're also, delegating tasks all the time to ground paramedics and firefighters. And you're making medical I mean, I've gone on traumas where I'm like, okay, we need to prioritize airway, breathing, circulation. We need to get a chest tube in this patient. I need to intubate them. I need to start some pressors, some blood. It's literally a flying ICU, we call it. So I think it was funny when, once again, another step in my applying to school, someone's like, this doesn't count. How does this translate? And it's like, maybe you're just not the program for me, and that's fine. There's going to
Totally.
be places that are not, I tell people apply everywhere, but and I'm sure you've heard this, Turnji, like they're interviewing you, but
You're
you're
also
also
interviewing
interviewing
them.
them.
Yeah.
You
And
want it
sometimes
to be a
it's not
good
a good fit.
match.
It goes both ways. I agree. Definitely. Wow. Well, thanks for enlightening me. I didn't know a lot about flight nursing up until today. So thank you for that. And
We also flew some toe pain and
no,
shit
if
that,
I was competing
was
against
good
you
for us.
guys for last cohort, it would have been really
Pet
hard
stretch.
for me. If I was competing against you guys last cohort, it would have been really hard for me. So I'm glad you are
I
already.
mean, you blew our GPAs out of the water, don't worry.
Oh yeah, there's not a competition when it comes to that.
There was plenty of schools I applied to that, wouldn't even look at me. I didn't even get a
Oh, I got
call.
rejected from schools.
It's I think that people who are out there who may not have the best grades or maybe not even the best experience or whatever you're missing, you need to be working towards fixing those and showing that you're willing to do the work.
You're trying to
But
adapt.
you also need to maybe pick certain programs that are that are realistic. I picked this program mainly because they were like, hey, we're only going to take into account your last 60 credits of
Hmm.
school, which saved me because I redid some courses, and I did well in my last few years.
I mean,
But
you're
when I
not
was a
the cam.
freshman,
You're not the
I
cam that you were like 10 years ago.
no, I was 17
No,
years
and that's
old.
the case
Exactly.
too. Like
Exactly. Yeah.
th- we're very atypical applicants because we've also been nurses for so long too. That's
Yeah.
not the typical either. So like what we were, when we first started, when we first became nurses, yeah, that's not the same. We're not the same people.
You're not the same people anymore. Not to say
Yeah.
that people like
I'm
you
way
were.
worse now.
Yeah.
I was gonna say
You've
that.
learned
Much
so many bad
worse of a human
habits.
being now. So much more jaded.
Right, right, right.
I
Well, you
know how to
guys
bullshit.
bullshit my way out of anything, huh?
There you go.
Yep,
That's the key.
Fake it,
Fake it
fake
till you
it,
make it, baby.
that is
fake
a
it.
real thing.
No, that now we do. So now we started sim last quarter. So now we are doing this quarter. We're doing everything, right? Soap, SAMTAT Apple, induction, emergent. I mean, induction maintenance,
Hmm.
emergent. So Dr. Lee's, he throws in some kind of scenarios. So I feel like you guys are already prepared to stay calm in those situations because, as you said, you guys have been so autonomous for so long. Like it doesn't really bothers you because you have seen that for so long. Versus me, who
I
has
will say it's still a
Do
challenge though in school because it's different, right? Like
yeah,
we did with patients who were either, not even inpatient yet, they're in the field.
yeah,
Um, and we're making rapid decisions and we're not clean about it, right? Like we're kind of just throwing things around and we'll throw the laryngoscope
you
over
can
here
tell,
and
yeah,
toss
we're more
this.
aggressive.
And it's definitely, especially when we first started our clinicals, I know I've talked to her a few times, like, we'll intubate someone and throw the laryngoscope like on their stomach.
Don't do
And
that.
like, immediately, the CRNAs
Or
or
I
anesthesia
touch
providers are
my
behind me like,
dirty
dude,
glove
what the
hand.
hell are you doing? Like, you
Yep.
don't throw a dirty laryngoscope on someone's freaking chest. And I'm like, I've been doing that for so long that it's hard for me to read,
muscle,
and I don't say that because I don't want them to be, giving me
yeah,
shit. But like, I'm like, oh, sorry, sir. Oops.
more like muscle memory.
Yeah, and it's just a different way of thinking that has, it's great that we have
It's
that
more
experience,
it's
but it's
more
hard to
finesse.
retone.
Yeah, now it's more
Yeah.
of
It's more
finesse. No,
finesse
no,
and pulling
no, it's
everything all together and making it clean.
yeah, it's more of a
Because
finesse
with
now.
Dr. Lease, too, he'd give me a scenario and I'd be like, fucking do this shit. And then he'd be like, yeah, but like, can we not do it so aggressively?
He
Why
would
don't you
tell
make
us
an
though,
anesthetic plan?
he would tell me and Cam though that we were pretty calm and like cool collected during certain things. Like even though on the inside we may be like, losing our shit, but like on the outside we portray a different, and I think that more comes from our background.
I
Yeah,
will say one of the complaints I've already received in clinical was that I seem like I am what did they say specifically? It was more like, can you have like a sense of urgency? And I'm like, I do. It's in my head. Like I'm
And
cogs are
that
turning, I'm making decisions, but I'm not outwardly showing that because
yeah.
I've rolled up to scenes where someone's half their body's missing, and like, what is freaking out gonna do? Like,
like they're
I don't know.
actually actively dying.
Yeah,
Which isn't
that's
to
not,
say I'm better than anybody. I'm
No,
not. Trust me, I still
no.
fuck up. But like, it's I'm not gonna sit there and one we are taught don't ever show that you're sweating, right? Like, and as an anesthesia provider, you're gonna be in
Yeah.
charge of
Because
the
if
of
I'm
that
not
patient.
nervous, then you shouldn't be nervous.
exactly.
Right. And
I
let
feel
me
like
tell you, like, no hit against OR nurses. They're great. Like, they do a lot of work, but they are not the best in an emergency situation because people don't code in the OR very often. It just doesn't happen often. Um, so if you're freaking out and you set that tone and you set that panic mode, everyone is going to feed off of that and they're going to panic too. Whereas if, yeah, you're intubating, but the SpO2 is dropping and the SATs are dropping, and you're just like, hey, cool, like we're gonna try a bougie. Can you go grab that glide scope real quick, and we'll try that once you get it in here. Blah blah blah.
Yeah, I'm just gonna bag them up.
Then they're not gonna freak. They're not gonna take that energy and like reciprocate it towards you. If you
Hmm.
start going,
like
get that
yeah,
freaking card, and like they're gonna start fumbling stuff too, and they're gonna take that and like be like, oh my god, there's a problem. We need to grab more people and have like 15 people watching, and it's just like no, like 2 3 people in here max. Like we're good. We can bag them. It's not an emergency. Like chill. So
I
I
used
think
to
that was a really good. I think that's the best thing I probably got from flight nursing, honestly, is how to deal with those tense situations without getting, overwhelmed or verklempt.
I agree with you guys, and I think you worded very nicely. There was this anesthesiologist that I used to shadow like 3 4 years ago, and he described it pretty well. I feel like he said that the anesthesia provider in the OR is like the manager. You're managing everything. If something goes wrong with vitals or whatever it is, the surgeon looks at you. Everyone looks at you all the time. Anything was to go wrong. And
Unless the surgeon's like hands deep inside of an incision, they
yeah,
will leave. Like if the patient codes, it just happened to me like a few months ago. The surgeon was like, "Cool," literally takes off his gown and he left the OR. So it's just
wow.
they are not going to deal with that patient, especially because they're the surgeon. They do not want that on their record. That's how surgeons are graded and rated, is like their percentages, and like that's why we say nobody dies in the OR. We move them out and get them to the ICU, right? Like the surgeon leaves. Like if they can, they're out. I mean, I think the exception would be probably cardiac surgery, but like
There's a lot
they're
of
not going to sit around while you're doing CPR and trying to.
yeah.
They'll be like, literally, he was like, "Let me know if you get him back," and left, just
Yeah,
walked out.
it's the same. We had a patient last night who was super sick, came from the ICU, but they was not optimized whatsoever. Like was a big open belly, and where, difficult airway, putting in an A line, putting in a central line, doing all these things, and they're already done with the surgery, and they're like, okay, like, meanwhile, we're like trying to hang pressors, get the central line in. And he's like, okay, like, let me know when they're back to the ICU, and it's like, okay.
Well,
Calm down now.
moving on. Can you tell me can you tell me what is something unique, like maybe one piece of experience or two pieces of experience that is a flight nurse can bring to this practice that an ICU nurse might not bring? I know you already mentioned that autonomous or that all that experience that you have got from emergency situations, but what else? Anything that you guys want to add to that?
I think it's actual hands-on skills because, you know, and I'm not saying that an ICU nurse is not skilled in many things, but we do bring having already knowing the logistics on how to intubate. Like we already know that because at least the flight company that I came from, we quarterly had to perform all of our advanced skills in front of our medical director, or like, so my medical director was an ER physician. So that means, we had to perform all of our direct laryngoscopies. We had to perform all of our emergency crikes. We had to do all of our chest tube insertions. We had to do any like fancy, if we had like did you guys do impellas and all that stuff? Yeah, like we would have in services on all of that. We'd do scenarios with the machines. We'd do kind of like grand rounds and pick certain cases that we've had. They'd just pull and we'd go through and do chart reviews. But yeah, we had to show him like that we are competent in all of these skills. That happened quarterly on top of actually having to perform them for our job. So I think that brings a certain edge. Whereas, these other ICU nurses, ER nurses, they've never intubated before. They've never had to put chest tubes in or advanced lines in or, had to manage other, machines they're not maybe comfortable with. So I think that's a big, big edge. Even just an airway in general, because and when you first look at an airway when you're intubating, it looks like just a bunch of pink tissue. You're like, what is all of this? I don't know. Like, why is their tongue so big? Why can't I get this out of the way? So just having that like little edge is, I think, really significant.
Yeah, and I think aside from skills, which are great to have, but like anyone can learn a skill, right? Like eventually. So even if you don't have those skills and you're an ICU nurse, that's fine. I think the main thing that's really helpful coming from either an ER emergency background or flight is that an ICU nurse would not maybe have as much as time management and flow. Um, we're used like in the ICU, you might have the same patient for a month or at least all 3 days of your shift. That doesn't happen in anesthesia. You have to see that patient that day. You pre-op them. You
Like,
see them.
yeah, adaptability.
You take a very 1,000-foot level view of this patient, and then you need to take care of them for a few hours or however long the surgery is, and then you're done with them, and then they're off. So that doesn't happen in ICU, and I do see like the ICU nurses that I work with who are now in anesthesia. That is a difficulty for them at first to be able to like get a patient immediately. Like there's no real report like there is in ICU. You know how they're like, you guys get these details report, every freckle on their ass, and like I don't give a shit. Like, have you eaten or drank in the last 8 hours? Do you have all your teeth?
Do you have any
Like
allergies?
what medications are you on? Do you have sleep apnea? Cool. Bye. Like, any pertinent medical history, that's all I care about, right? Chart by exception is what we used to say in the ER. I think that's probably harder for some, not all ICU nurses, because you're just so in depth with your patients and in tune and you know everything, which is also great. Like that's a great thing too, because now you know how to titrate and deal with
But
patients really
you
well.
have to be able to
That's
adapt to
part of what
different
I hated
situations.
about ICU nursing. I hated coming back to the same patient. hated it. Like I was like, I don't want the same person for 12 hours a day, man. Like I'm bored. Um, See them, treat them, and eat them. Like I don't want it anymore. So I think that the flow and just the time management skills is probably a really big part of that, and making those decisions definitively and quickly.
Like, so Cam probably takes report on like a sticky note then.
I never
He
used
doesn't.
paper at
He
all.
doesn't.
He
I
doesn't.
seriously, like, I did a travel assignment at a cardiac ICU, which they should never have put me in. That was their fault.
It's
But
all
I
easy.
didn't even carry paper around. Like, and they were pissed. I got written up. Like, the first day, they're like, "You're not using paper." And I was like, "It's on Epic. What the hell do I need paper for?"
Yeah,
Like,
it's everything is on Epic.
like what? And I was like, what, what do I need to write down? It's all right on this computer that you guys pay hundreds of millions of dollars for. What do you, like, why? And they don't like that. I'm not type A. But you
I,
don't take notes on paper in anesthesia, right? Like you just go see the patient, pre-op them, and then you go do the anesthesia. So I kind of like that time management part of it, and that you need to like get things done because the OR doesn't stop. It's a very time, like they are ready to go when they're ready to go. So it's a lot of time management. That
time is money,
Yeah, I mean it is.
honestly. I mean,
Surgery is
that's
the
what it
money
comes
maker
down
of the
to.
hospital.
Yeah.
So
Especially when you're in an OR and the ORs are
Mhm.
booked, one after the other. You need to be able to,
yeah, they don't want
put
your
them to
excuse.
sleep and wake them up in a timely fashion.
The OR
Teach.
nurses don't care, man. Like it's funny. Like they're already calling the PACU to be like, "Hey, we're rolling out in 5 minutes," and I'm like,
The tube's still in.
"We are? I guess we are. I better make this happen."
All
Like,
right.
it's funny because they're like, "No, dude, we need to stay on time. You need to figure out how to extubate them in the next, safely, of course. Like if you can. If you
Yeah.
can't, you tell them, hey, I can't. But you need to stay on those time schedules if you can. So yeah, very long-winded. All these are long-winded because her and I like to talk, but I think that's probably one of the good things about it is just learning
But
that
we
kind of
all bring, like,
flow.
we can say all this stuff, but it is important to say, like, we all bring different things to the table. And
Yes.
I think especially for national, I think that that's what makes it so great is that
Mhm.
our class is so diverse.
Yeah.
Oh,
And
when
so,
I worked in that
like,
cardiac ICU, even though I hated it, I was so impressed by the knowledge that those nurses had in that ICU, and
They're
like,
smart.
oh, dude, like the just knowledge and depth of the vasopressors and how to use them and whatnot. I was so damn impressed. Like, I was like, I never want to know it to that depth ever. I don't care. I'll just slam some
even,
shit. But
yeah,
it was, I mean, I trust me, like having that experience, it does not make you, like, not having flight and having that does not make you a less of an anesthesia provider. You are going
Different.
to be, you're still going to be great. Like
Yeah.
it's just different things. Like I said, I like that about national, that they're willing to look at all those different pictures and be
yeah,
like, you bring this to the table, that's awesome. You bring this to the table, that's awesome. We're all going to be
Take up the
different
risk.
types of anesthesia providers, but you're all going to be competent and able to
yeah.
practice independently, and you're going to be good.
So my first job was at a thoracic vascular surgical ICU, and the nurses
God
there,
bless you.
even though I was a new grad, but like the bar that was set by the nurses of that unit was that the residents and even the fellows would take nurses' recommendations because the
Mhm.
nurses knew so much
Yeah.
about drugs, anything, any kind of situations because they were so like they knew their shit. They literally
Hmm.
knew their
Yeah.
shit.
And I
Residents would be
think that's super helpful for
yeah,
anesthesia because one of the other main things I learned in flight that I didn't learn in like early IC was everything is weight based in
yeah,
anesthesia.
everything is
Everything, especially when you're dealing with kids, but even when you're not, it's all weight based.
yeah.
So that's all you do in flight, at least, is weight
Yeah,
based.
you need to
Everything's
be
weight
able
based.
to do those
So I
calculations.
already knew all that, which was really
Yeah.
nice when we got into our pharmacology and stuff. I know all those dosages already, which was great to already know.
That is
And I know
very
in cardiac
nice.
ICU, a lot of them know that was weight based for vasopressors and all that
I
stuff as
will
well.
say that's probably another like little adjunct, at least that flight and ICU nurses have over ER is that um,
For sure.
because in the ER you're just hanging stuff, pushing stuff. Who knows, I mean, what the exact
Last
dosage
one's
is.
asked me how
You're
much
just
ketamine
trying
I
to
gave,
keep
and I
people
went, that
alive.
much.
Yeah. So like, yeah, you're just trying to keep them alive, whereas like we are actually trying to like, it's a little bit more finesse.
Yeah, it's a
Yeah.
little bit
And there's a
more
time and place for those things.
Yeah.
yeah,
Like,
both. Well, they're
you
just
can't
trying
do
yeah, they're
that
trying to keep them
in
alive.
yeah, you can't sit there and calculate all this stuff in ER when you're trying to do some emergent thing.
Yeah.
But if you're in an ICU while there's, you can't just be like this much ketamine. Like they'll be like, what does that mean? And I'm like, I don't know. That much though is what I give generally. So
Enough to do the job.
enough
Titrate to
to
effect.
work. Titrate to
Titrate,
effect. That you'll hear that all the time.
titrate to effect.
There
Any,
are no pumps in
any,
in the OR. Rare, very rare. Do we put anything on a pump?
wow. So that's a different
The
thing that
nurse the other day was like getting blood for us, and she's like, "Do you have a pump?" I'm like, using a pump?
No.
there are no pumps. Okay, question for you
There's
guys. Any, any kind of, any kind of memory, any like, or any kind of patient that you saw and you were like, what the fudge? Like you saw the patient or where you were taking care of as a flight nurse and you were like, damn, I've never seen this, and it like shocked you and like any impact that it had on you that you still
I'm
remember.
sure Caitlin has many because I've heard these stories.
Yeah.
I'll let her go.
So,
Story.
so the flight job that I worked extremely rural. So, and on the Navajo reservation mainly. So a lot of the places that we went, a lot of the 911 response, it was very much just us. Like typically you have help from the hospital or help from like a ground crew. We were lucky if we did. So yeah, I've seen a lot of stuff. It's hard to kind of pick, but there's always one that sticks with me. It's not like a very like I've seen gruesome things. I think we all have, but like it's not very rare that you get a lot of saves. And I think that's probably why it sticks with me. But yeah, so we got called for a 911 scene response, and we were in the helicopter. We were about to land in the middle of nowhere. And we got called. So, and this is the thing too. They'll tell you, I think they told us the patient was having like seizure-like things or whatever it was. So you don't get anything. We didn't get an age, we didn't get a weight. All we had was seizure-like activity. That's it. So we're about to land, and an ambulance is there, and we're landing. The blades are still spinning, and all of a sudden, I see all of the ambulance crew just jump out of the ambulance, running towards the helicopter with the
Always a
blades
bad
still
sign.
spinning. And
Always.
so then I have to, whack open the door, jump out, because the blades, when you're shutting down the helicopter, the blades dip pretty low. I'm short, thank God. I'm only 5'2", but for normal height people, that is enough to come into contact. So you kind of have to be aware a lot of safety too. So they jumped out because they were scared because the patient was coding. So me and my partner were like, okay, well, this changes everything. So we grab all of our stuff, we get in there. And thankfully it was a very good ambulance crew. Like they at least knew like very good ACLS. They had started compressions, and we get in there and he was a VFib arrest. So we're doing compressions, we're doing all the things. We do run round of epi,
No,
amio.
sorry to interrupt.
Um,
Sorry to interrupt you. You
yeah, go ahead.
said they at least. Start from there again. We lost you.
Yeah, they at least had good like ACLS, like they knew how to do CPR. They were already like having the ambu and bagging the patient, like very basic skills, but like I said, sometimes that's hit or miss where I worked. So they were actively doing compressions. We stopped. He was a VFib arrest. We did one round of epi amio compressions and got him back. We were able to recognize that he was super bradycardic, hypotensive, and then we did a 12 lead EKG, and he had ST elevation in the inferior lead. So he was a very right-sided MI. We ended up doing, so I did the intubation on him. I gave him a nice little bump of a vasopressor just before intubation because I knew once we were going to intubate, he would drop again, prevented another cardiac arrest, put him on vasoactive drips. It was a difficult intubation. I was glad that I had my paramedic there to help me because they are gold. They are the airway masters also. And yeah, so we transported him. That was the only time that he arrested. He didn't arrest in our care. We transported him to the local like level 1, went right to cath lab, alerted the cath lab team, and then he was sent home within a few days. They cathed him, and yeah, and then we saw him 2 weeks later, he came to our base with his family and brought us food, and like we saw him, and it was crazy. That's like the only time I've ever, we do a lot of work, we save lives and stuff, but it's not very
A lot
often
of
that you
deaths
get to like
too.
see the
Yeah,
other side of it.
you don't get to see the outside. Yeah, I mean, I feel
Yeah.
like I saw that a lot in ICU, but I guess you don't see that a lot in ER, like nursing.
No, because we just bandage them up and send them home, and then that's it.
We used to get food all the time from families. Wow.
Yeah,
Well,
that is the thing I hated about ER, aside
there
from
was
all
no
the
free food for family.
psychiatric and crazy people, was that I didn't get to get good food. No. um, no, that you didn't know what happened to these patients, you know.
Yeah,
Sometimes
you
you
really
send them
don't.
up and or to OR, and sometimes you try to follow up, but generally you just didn't know. And
Yeah,
sometimes that was better, probably, to not know.
it's
Most of
it's
them
just
don't make
like
it,
that.
Yeah, or they don't, quality of life, right? Like some of them make it, but they never live the same life again. So,
Yeah.
um,
I have
so
I
that's
have
always
other gruesome stories, but I figured that
they're all
that was a
gruesome.
better story.
We'll do like a
That was
horror.
a nice, heartfelt story.
Yeah.
Yeah, that was very heartfelt. I could feel it here.
Yeah, I'm feeling it. Yeah, it might
Deep
be
down in there
nice pain
somewhere.
from all the stress, but I think
I
it's
might get
also
a right side MI now. I feel it
Yeah.
here. All right, moving forward. So how was the actual CRNA school process for you? So Cameron, I'll start with you. How many schools did you apply? What cycle was this for you? What did you do? Do you still work?
um this sounds horrible. I didn't apply to that many, and I was kind of still battling what I wanted. I was applying to medical schools actually too, because during COVID they got rid of the MCAT thing. So I was like, maybe I'll throw in some med school stuff, just to see, because I don't have time to take it. Um, and then I just ended up saying, I got into flight and started doing that. But um, I will say I just never thought I'd get in, to be honest with you. Um, the grades. I had some personal stuff going on. I mean, I've made this like public. I had some licensing issues and stuff too. So I just was like, why would they take me over, someone like Taranjeet, who's got a 4.2 grade point average and has been
Literally.
planning this and has this heartfelt story about midwifery and all this amazing stuff.
Amazing.
And he's
Amazing.
just like, he meets the diversity quota and
God.
He
and
has a
he's just
turban
he's great.
on.
He's
He
worked
has
in
a
a cardiothoracic ICU, and I'm
right.
like, this is the guy that I have to go
It's
up
so
against.
true though. Yeah, it's so
And
true.
and I'm like, why would you? If you had me and Taranjeet next to each other, why would you pick me? And so I told myself that so many times. Seriously though, like
Yeah.
that I was like, why apply? And you know, you miss 100% of the shots you don't take. Thanks, Wayne Gretzky. But like, I just figured, screw it. I'll throw in some applications to see. Um, I interviewed with a few. I think I interviewed with like
Didn't you
one in.
interview with Rosalind Franklin? Is that
Yeah, I did. They hated me. That was not a good interview. I have my own stories about that. But it wouldn't have been a good fit for me. Like it wouldn't have been. It would have been, And I'm so glad now that I know about, like, my buddy went to Boston for his CRNA school, and like when I've told him the experiences I've had here, it's great. But yeah, I didn't apply to a ton. Um, I will say I was very flexible. I was flexible when I went to nursing school. And I think that anyone who is applying, I know that people have families. I know that you might live in sunny California and you're like, I'm not leaving the state. I'm staying in California. People tell me this all the time. I get messages all the time like, hey, I want to go to CRNA school, but I'm not willing to relocate. And I'm like, good luck. I mean, you might get in. There's people who do, but unless you're a stellar applicant, you are limiting yourself so much. Um, and if you really want it, you'll go where you need to go. I would have gone to Puerto Rico if I spoke Spanish. Like, I would have applied there. Like, I wouldn't have cared. I for nursing school applied everywhere. I went to nursing school in Kentucky, and I'm from Southern California because that's where I got in. That's where it started the soonest, and that's it got me to where I needed to be. And I was willing to relocate. I'd never been to Kentucky. Like, I was like, I don't know, fried chicken, like, cool. And I did it, like, whatever, and it actually worked out, and I got a great experience. But I applied to national not knowing really anything about the program, to be honest, and I hadn't gone to conferences, which I will say, looking back now, and anyone who is applying, I think that is a good idea to go to a few. Because the networking, I'm sure you know this, like, is amazing. I never did. I never went. And looking back, I think almost everyone besides me in our program was going to conferences, and I don't know how I got in, honestly, because I didn't go to any. But I think that's a great networking opportunity, and I think applying to you gotta just apply everywhere. And yeah, like, I'm glad I got into this program because their emphasis on an independent practice, and it aligns with a lot of my values, and that just was lucky. Um, but the interview process for me was, I guess, traditional in that way. Um, I know people prep and they buy these programs to prep, and there's a lot of scams out there too, from even the CRNAs currently, who are out there like saying they're going to prep you and stuff. And it's, um, I talked to Michael McKinnon, who is our director or our assistant director, and he was saying that, um, it's very obvious when people do those programs, those practice interview programs, because they're very scripted. He's like, I think he wrote this on Reddit even. He was like, I can tell immediately within the first minute if you took a program that taught you how to do interviews, because he's like, they're so scripted and everyone's is the same, and you're not like standing out whatsoever. And I'll say my interview was not traditional at all. Like, it started off very like kind of just almost like a friendship buddy buddy thing, and it was very like natural, and I kind of just talked like I am now, and I think that did help.
think that's
Because I
I
was
think
me.
that's I resonate to that so much because I feel like I've spoke to other people and I applied to one more school.
You
No,
have to
you
be
practiced with
personable.
us, and
You
your
have to
story
be
was so unique.
you have
It's
to
it's
be an
like
actual person. You can't be
no,
a robot. You
they
can't just
want to hear you.
regurgitate, yeah,
Yeah,
the answers that you've practiced in your head. Some of it
Yeah.
has to actually like come from the heart, and they actually do look at
they
things
care.
too, because I remember they asked me, because I remember I was a bad student. They asked me, I think it was Dr. Kramer, because he's our physiology teacher. He was like, "So, I saw that you got this so and so grade in, a class that was years ago." And I said, "Yep, like, yep, I totally did, but I took this and this class recently and I got an A plus." Like, and he was like, "Great, great." So like they look at everything. They know you before you even are in sitting
They
in the
have looked you up.
Dr. Kramer
Anything that
told
is.
Dr. Kramer asked me, sorry to interrupt you, but Dr. Kramer told me
No, no, go for it.
you only have 15 months of ICU experience. Why should
they
I pick you?
know.
Why should I
Yeah,
pick you over someone who has 10 years
Yep.
of ICU experience? And I was like,
yeah.
solid question. And I told him
It's a good question.
no one else moved to the Midwest for like negative 36-degree weather to get their best ICU experience, but I did, and he was like, I'm
But I
sold.
did. I'm here.
And
But
that's the thing. You need to be prepared. You need to look at what your weaknesses are when you apply, and know that they are going to ask you exactly why, how, what, when, and where that weakness occurred. And they want to hear how you either triumphed over
Yeah.
it or what you're doing to fix it.
And
If you just say, I don't know, or you crumble, they're, why pick you?
And
Just
especially Cam can resonate to this too. Like, don't hide anything. Don't like, don't lie. Don't, this community
they
is
will
so
find out.
small. They know. They just know.
I know people who lied. Someone just told me the story actually at the clinical site, who have lied about their whatever they're lying about in their interview, and you know, someone actually, this was just like the other day, that they
I've
made it
heard
through
something too. I heard,
three. They almost made it through the entire program. They had like 3 months left, and then the faculty found out they lied in their interview. Done. Done. They kicked them out of the program. Done. They were like, "You're a liar. You are not somebody we want in this program. You're not graduating." They had 3 months left
yeah,
because they
it
lied.
happens.
They
It
were like,
happens.
had they told the truth, they would have been fine. But
Yeah.
like, they lied, and they're like, we don't want somebody who's a liar coming out of our program, who
And even
who
like
is
on
only
a,
here under false pretenses, essentially.
yeah, and even on a
So
lesser scale than that, like I heard
we
the other
all have skeletons and issues.
Yeah. I heard the other day two CRNAs were talking, and one was an admin person at a very well-known school, like, where we rotate. And he was like, "Yeah, there was an applicant," and
Oh, Katie Lynn.
they said, um, they
we're gonna have to
said,
start again.
oh,
We'll have you start. We'll have you start again
I
from
can
where you
literally
said
hear you
where we
guys.
rotate.
Okay.
No,
Yeah,
but you
Um,
it's
keep
our
breathing.
internet.
I literally can hear you guys perfectly. Um, So yeah, two CRNAs were talking, and he is an admin at one of the bigger schools where we rotate, and he was saying that there was an applicant who told him that, oh yeah, I shadowed with so and so for this many hours. He was like,
That's
oh okay,
horrifying.
and then calls the CRNA personally, says, hey, do you know so and so? And they're like, no, I have absolutely no idea who that is. Oh well, they said that they shadowed with you. Nope, nope, they didn't. We're like, oh okay,
That's
It
but
is a
that's
like.
small
why.
world.
No, I've heard that so many times. I
Yeah,
think
so you just have to be
Ken was
careful.
talking about that too. So everyone who like asks me for opinion, and if I look at their resumes and there's like references CRNA, 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 I'm like, nah, you need to take that out
Yeah,
because
there
there's
are
all
only there are
that,
only 60,000
yeah,
registered CRNAs
CRNA
in the United
compared to
States.
like 6 million nurses or whatever million
Three
how many
point something,
nurses there
2%
are.
basically.
Yeah,
Yeah.
Everyone knows everybody in some capacity, and of
Yeah.
those 60,000 registered CRNAs, a lot of them are not practicing anymore. So
yeah,
like, it's really stupid to try to lie about either knowing somebody or working with somebody or doing something in this field
that's what, like
because
name drop
they
doesn't
will
work.
know someone who knows somebody.
Yeah.
Just don't.
Yeah, you just gotta be your authentic self, and I feel
Yeah.
like if you don't
Yeah,
give, yeah,
and going back to your question, like there are like I touched on earlier, there are gonna be programs who don't want your story, right? Like there might be like there are programs that have set type of applicant that they want, whether it's they want someone with, you know, a perfect grade point average no matter what. They want a perfect student. They don't really care about your personal story. They just want on paper you to be stellar student because they want that matriculation rate. They want you to pass that NCE immediately. And that's fine. There's programs like that. And, you know, that's not a program I ever would have gotten into. I got in because my experience was great, my story was good. But and I found that out that there are those programs out there that are they just don't care. But there are programs out there who like that much more. That said, generally it's on a point system, right? When they interview you, and GPA is almost always the most amount of points available on a application when they assign points. Um, so I mean, if you have bad grades, you should probably redo some of those courses. Unfortunately, you just have to do that because
Did.
it is a huge chunk of what the application is.
moving forward, are you guys working at all? I don't think you are.
What are we doing?
Do you guys
Working.
work at all?
Oh no,
Not during
do
the
not work.
program.
You can't work in every. I get this question every week. Someone messages me every. Why am I so passionate today?
I don't
Um,
know. Calm down.
because I'm Charlie. Um, um, that's a Sunny in Philadelphia reference.
Yes.
Um, everyone always asks me that. Like I get questions. I just got one 2 days ago.
I told
Can I
Tara Pete
work?
this.
Yeah,
You can't. Yeah, you're the culprit.
I don't work.
Yeah, I'm like, you can't.
Sorry.
You
Well,
asked though. You were like
I had
very
the same,
inquisitive about working,
I
and when we
had
spoke,
the
you were like, "I'm
same,
gonna try."
I
Hey,
had
I
the same
didn't know.
mindset. I had,
I did not know that loans cover it all. I have never taken a loan in my life. So when
Yeah,
I took the Grad Plus loan and now it's like actually paying for my mortgage, I don't work anymore. I didn't know that. That's why I was like nervous.
yeah.
yeah,
It's
no,
scary. It's scary to not
It's
work,
scary.
especially when you're an adult. Like I'm 32, to go have a
Bills
career
don't
already and
pay.
then
No.
not
Yeah.
is
yeah.
weird.
But
Like
no,
I know.
I had the goals of wanting to work when we started because, we're just taking classes and we're a full-time student, but I'm still gonna have time to work. I can fly, I can get a little per diem and a pack you. No, you absolutely cannot. Like
Can't.
when I tell you that we were studying for I mean, upwards. I was a little crazy the first
Oh,
semester,
you
like
all were,
because me and Cam had also been out of school for a very long time, like real school for a very long time.
and we
So,
sucked
uh,
at it.
yeah, so adapting to new ways of studying is a whole nother thing. But, we were studying for like 12 hours a day. That's an average. So, like, tell me when you can work in between that. You
Yeah, I wish
can't.
that was an exaggeration. It's not.
Yeah, like you can't. It's just
I
not.
will say I did work for the first 6 months, but it wasn't. I
Different.
could have not done bedside. There's no way if I was an ICU nurse or an ER nurse, I could have worked. And I know you'll attest to this, Tangi. Like, imagine this term working. Like, and it's not even. Some people are like, well, what about the weekends? It's like, sure, you could. And I think there was a guy in our program who did on the weekends, but in reality, like, how much
You're
money are you going to make from a weekend or two a month? Is
and
I
that
you're
think
worth the
only
stress and all
I
this
yeah.
think
to
it,
make, let's
yeah,
just
I
say
think
You're
it's
$2,000
cheating
a month?
yourself. You're cheating yourself
it's like
because,
it's
instead of getting, you maybe you got a C, which is failing on a test where you could have gotten, a high B or an A because
passing.
you were working,
I
you
think you
know?
just really have to talk to yourself. Because me, I try to study on the weekdays and then try to reserve weekend for activities for like my family, go see my
Yeah,
girlfriend, or this thing because I'm
you have
passionate
to.
about this, right? So,
Yeah.
You don't want
you
to
know,
be spending
that
those
balance.
weekends in the ICU.
And
No,
you're Taranji, you're in your hardest. This is like the hardest semester right now.
yeah.
So
So if I
like
don't
We were
fail,
talking about that before you got on.
if I
this is
don't
the
fail,
hardest semester. I
It is.
remember.
And the
I mean,
next
if I
one's
don't
not as
fail,
hard, but you'll be burnout.
Yeah. Yeah.
oh man,
But
I'm
yeah,
all
it's just, I worked for 6 months because I did flight and I was not at a busy station, so I could sit and study. That's what I did. I would go to work, check out the helicopter, and do our checkouts, and then I would literally sit there and study for 12 hours. And
Mhm.
if we got a call, sure, I'd go on it, come back, immediately start studying again. You can't do that in an ICU environment because you're taking care of a patient the entire 12 hours.
You're
So you can't,
distracted. You don't have the
yeah, you're
time.
distracted, people are talking to you, whatever. You can't sit there and study the
No.
entire time. Um, so that's the only reason why I did it. And in reality, looking back, the money I made was not, it wasn't enough to,
Equivalent to the time that you could have spent studying.
no. I was, I had a good
Yeah.
time at work. I liked it, but like, I was also
I feel
chilling
like
in
the
a
risk is too much. I feel like the risk is
It
too
was
much.
actually too, it was very hard for us to give up flight too, is something that we
yeah.
Yeah,
haven't talked
I bet.
about, that me and Cam have like talked about at length. And it's really, it's like, it's like an end of an era because we loved it. So it's the funnest job I've ever had. It's
The
really,
best
it's
job in
not
the
like,
world.
yeah, it's like nothing else. So to end something like that, it's a big deal. And it's almost like, I don't know, yeah, like you're mourning like, like a career, a whole career, and starting something different.
I think it's hard for everyone. I mean, people work in
It is.
units where they love the people they work with, and
Yeah.
I miss the Kai I miss the Kaiser money. I miss my coworkers.
you might miss the money, but a lot of people miss the people, or a lot
I
of
miss the
Yeah.
people,
coworkers. I
some
miss
people
my
who've worked
coworkers.
for 12 years in the same unit, that's their family.
Yeah, that's a
Like
big deal.
that's hard to walk away from, especially for 3 years of no pay and not seeing those people anymore, and you're on to different things, and it's the end of an era. But it's a sacrifice that is going to be worth it in the end because you're going to have a better work-life balance. You're going to make great money. You're going to be able to have autonomy and enjoy your job a lot more, I think, in the long run. And I wouldn't be doing this if I didn't think it was worth it.
Yeah,
Um, but it
100%.
is a sacrifice, and I do
Yeah.
miss
There,
that job. I
there,
miss that job every day. The hospital I'm
Mhm.
at now has the company I used to work for has a
Oh yeah.
helicopter right outside. I see them every day, and I'm like,
wow.
I miss it. But it's also like, would I go back? No. I know I'm making the right decision.
Yeah.
Looking at the bigger picture.
Plus, I got fired because I was pretty and they didn't want me there anymore. Didn't get a choice.
Maybe you should have started with that.
That's another story for another podcast. There, you could do a
Where did you
whole
fire
Cameron
us?
segment
He's like,
for
we're never having you
degenerates.
guys again.
Degenerates for nursing.
Caitlin said that I might have to fire you from the
Yeah.
podcast.
It's like news. It's like when news has like a specialty person come in every few times, like a physician or
Right.
something, to talk about something. Be like, here's our resident degenerate to come talk about what not to do.
And
This is
here's
what.
the HR line to call.
Yeah. Oh, the amount of write-ups in my life. So
Look at you now.
Anyway,
it's a
Okay, moving
lot.
forward. So, how do you guys currently, now that you're in clinicals? Okay, so I interviewed David Warren, and he told me
oh,
that
David.
clinicals, yeah, he told me that
He didn't
clinicals
tell me
are,
that. I'm gonna kick his ass.
he told me that clinicals were much better for him than
Oh
didactic.
yeah, 100%.
Do you guys agree?
Didactic sucks.
I've talked to a lot of people about because there's two different types of programs, right? There's integrated and front-loaded. And so for us, we're front-loaded, right? So your first, what, 12, what is it, 18 months? 12 months? Right.
It's no 15 months, I
The
think.
first 15 months of our program,
Yeah.
you don't see an OR, not once. So there's pros and cons to that, right? Like I get all the hard stuff out of the way, I'm learning all the information. So then when I do go to the OR, I have all that information in my toolkit now. But I haven't seen any of it, and it's all just like abstract. And now when I'm seeing certain things, like I don't know, I was joking the other day, like we did a fracture hip or something, and there was like the love post, and I'm like remembering us always talking about the nerve
The
injuries
love
and operator
post.
stuff, and I'm like, oh, that's what they were talking about. I had never seen it, or it was all just like abstract knowledge, and when you see it, it helps learn and like it helps that so much more, which is what it's hard about front loaded. You don't see any of that for the first 15 months. Then you go to clinical, and you're basically only doing clinical. We have a few classes on the side, but not a ton because we
They're
got
not,
it
yeah.
done. Whereas I was talking to my preceptor who did an integrate, and he's like, I liked that I did that because he's like, we would go to the OR once a week at the beginning, so then we could reinforce all those things that we were learning and actually see them. And he's like, the first term we just observed, like he's like, we didn't do anything, but at least we could get he's like, it helped put a lot of things into perspective when you're reading out of a textbook, because it's really hard to do that when this is all foreign stuff, you know. Yeah, we've been nurses, but I had never been in an OR ever before I applied for CRNA school, except for my one shadowing experience, which was not great. Like, but I had never really been in an operating room. You know, I saw the red line when I did trauma, and I'm like, don't cross that. And when I crossed it for the first time in my first clinical, I almost had like a mini heart attack because I know I'm not supposed to cross it. I'm like, ooh,
Not in our dirty flight suits.
right. I'm like, ooh, don't cross the red line, and now I'm like walking right across it. It was like a weird feeling. So I would say now, though, especially having all those classes out of the way, it is such a relief, but also it's so nice to be doing now again. I'm a
Yeah,
doer.
you're
I'm
able to put the knowledge to your hands and actually.
Also, I also feel like I've looked up a lot of schools, and I feel like this is quite unique to national. And I don't know if you guys feel the same way, but having like 21 months of clinicals, I feel like that's such a pro. Like,
I
yeah,
mean, our program ends up with way more cases and hours than most
yeah,
programs do.
I feel like even for our first rotation, we had very high numbers.
I mean, I'm already my first rotation. I don't know how to put this into a ton of perspective. I'd have to ask a few other people, but I know it's not as high-ish. But I mean, what you had 300 plus hours of
Oh
anesthesia
no,
time.
no, no, no. I had over 500 hours of anesthesia, and I think I
Yeah,
almost hit 200 cases.
yeah. I
I
had
had
250
over 100
wow,
intubations. Yeah,
for 3 months.
for three
that's
months.
crazy.
That's a lot. Like, you know, and that's a huge.
It feels
Uh,
like a lot.
I think that's important. I mean, that's a huge um, talking point between the MDAs and and CRNAs is that we don't get enough training, in hours compared to them, which you know we're just doing ourselves a disservice by doing these programs that are doing the bare minimum. It's that's why those arguments
No.
exist.
Yeah, we'll be very well prepared.
That's
National needs to pay me for talking their program up so much is what I think. I need at least 20K off
I
my.
just did
I need
28
to
hours in the past
need
2 days
this.
of free anesthesia.
Wow, look at that.
I did calculate how much I would have made. This might be fun. Don't do this; it'll make you really depressed. I calculated with the amount of anesthesia hours, not clinical time, but just anesthesia hours, if I was
Yeah.
billing for my billable services. So I did 210 an hour because that's about what the thing is right now for locums.
Yeah.
And I would have made 150,000 last term in 3 months had I billed for just the anesthesia time, not even just the.
Oh,
I
Yeah.
geez.
can't think of that. I can't
How,
think of that
how
right
to
now.
See
make
how
it,
depressing that is? But
how to
that,
make
for me,
it,
that's motivation.
how to make it depressed, how to make yourself depressed.
I know all my preceptors were like, "Why? Don't do that. Don't do
Why
that."
would you do that?
That's
But
like,
you're almost there, Darren G. You're almost to clinicals.
yeah.
Yeah, if I pass this quarter.
If you're ever sad, just go to Gasworks or
I
Gasworks,
don't do that
Yeah.
anymore. Oh my
sort
God.
Oh, that's
highest to
snow.
lowest, and see what
I
they're
don't,
paying right now.
I don't do that anymore. I used to
Oh,
do
I
that.
do it. I
Well,
do it
that was a
every week.
motivation for me to
Yesterday,
get into the program. I used to do that one when I was applying to the programs. Because like, bro, if you gotta make that money, you gotta live that comfortable life, do your dreams. You
right?
gotta look at it every day. But now that I'm in a program, it was even my, you won't believe it, it was even my wallpaper of my laptop.
Fuck yeah. Why not?
I didn't
So,
know.
all this said, if you're applying to CRNA school, do
You should
not
look at
mention
It's not
any of
about
this in your
Oh,
interview because
can't
they
be
know that you're going into it because it's a well-paying field. Do not mention that's why you're doing this, please.
yeah.
That's like
I
The
feel
the
like
reason
you can't really do it for money
yeah.
now. It's a lot. Three
I would
years is a lot.
money's the reason I'm doing it, but it damn well helps. Especially with all the debt we go into. I mean, I'm
Oh yeah.
already
Yeah,
at 200,000.
gotta pay for it somehow.
Yeah.
It's a lot of
But I
depth.
really wanted the autonomy, and I really wanted to be able to make, my own decisions. And I will not work in an ACT model when I graduate. I will work independent. Like I
Yeah,
just like I
100%.
don't want to do that.
And that's
So
the beauty. That's the beauty of national. Like whatever you want to do, I feel like it prepares you for that. You could, if
Oh,
you
right.
want ACT, it'll prepare you for that.
well,
If you want independent,
I'll tell you right now, and Cam can probably say the same thing. It's like, they these places really do like national students because more times than not, and this is talking about many classmates that we've been told that like we are not performing like juniors. We are performing like they're like, oh, I would have thought you were a senior. Like, you're like, above where you should be, and they really enjoy us. So, um, and
Maybe
I'm
that's
at a
her.
site,
I'm
yeah,
both.
I'm at a site right now that has 5 juniors, so me and my classmates, and then 2 seniors from national. So we have a lot of students there.
I've heard about that site a lot actually.
It's a really good site for
One of my
independence.
pals, one of my pals who is
Where are you at?
Huh? Bakersfield.
Kern Medical
Current,
Center.
current.
I've heard really good stuff about that. Okay, moving forward, what are your guys' future goals? I've heard from Cameron he wants to work local, whoever pays him the most. Got it. What about you,
No, that's not.
Cameron?
I
Just
want to move
kidding.
to Florida, honestly, but luckily they are starting to get more independent sites. Because as you know, the East Coast is mostly ACT,
Yeah,
but they are. It seems like it's changing, which is good. It's good for us.
yeah,
Like,
industry.
because I look it up all the time and I see there are more and more independent sites, and I've talked to a few people about it. So I would like to live in the East Coast, but um,
Midwest has a lot of independent sites too.
yeah, but you're in the Midwest.
Yeah,
Like, I want a
I
boat
lived there
on
one
the
year.
water. Like, I don't want to live in Wisconsin.
I'm kind of like up in the air. So I'm originally from Boston, so all of my family is there. And they beg me all the time. But again, like he's saying, it's majority ACT. It's not as much independent. So I probably don't see myself going back there anytime soon. Um, I probably will stay like in the area of school maybe for the first year or two, just to cash, some money, work
Yeah,
independent, like work in the areas that I know. And then
yeah.
my passion really is rural medicine. So I
She
could see
froze again.
myself at
What
like
does she
That's
a,
what
love?
she loves.
yeah,
You don't know what she loves.
yeah. So I really
What do
just
you
love
love?
What do
I
you love? You
love,
froze.
What do you love?
I love the independence. So yeah, like this really does breed you to be like at the top
Agree.
of your game. And that's coming from seniors too, like seniors who went right to independent practice saying like they felt 100% comfortable.
Yeah, I was talking to David. He already has a bunch of offers lined up.
Oh, I'm sure he
It'd be
does.
fun to put someone who is in a program that is heavily ACT clinicals and have them
That
talk
is,
about.
yeah, like
I know
Kaiser.
someone you can have on here.
Isn't
Would that be
Kaiser?
interesting? Huh?
Hmm?
Isn't Kaiser, they go to a lot of ACT, right?
No, but I would like to have someone from the East Coast, honestly, because I know
East Coast
how
would be fun.
Yeah.
I just know how different it is, and I'd like to hear their perspective about their clinicals and like
Yeah,
what experiences they're having.
the last clinical site I worked, there was a couple people who went to school in New York and worked in New York, like not like New York City, just
Not
like
a
New
good
York
place
State.
for CRNAs.
Um, but yeah, they said it was really tough. Majority supervised. And then they came to Arizona and they like love their lives now. They wanted the independence and yeah.
We
It's
have
a
a New Yorker at
transition
my
for them. It's a transition for them because they're not used to doing that now, but like it's really they love it.
Well, a
And we
lot of
have,
these programs are university programs. So
yeah.
that means they have a medical school, which means their priority is the physician anesthesiologist's residence. That's who they're going to pick first. So if you're going to Duke and then you're at Duke Medical Center, you are at the bottom. Like you're not
Wait,
going to get the cases that the anesthesia resident is who goes to Duke. That's who's
so
getting.
holding that thought, do you guys have to compete with anesthesia residents?
Too.
At my site, there is none. We don't
Yeah.
have. Mine is only a CRNA practice. There are
I
zero
haven't
physician
had to.
anesthesiologists.
The past couple shifts though, there's been like not like anesthesia medical students, just medical students in general trying to intubate, a couple paramedics and stuff, but like um but it's a good teaching opportunity also for
Yeah.
you to be able to like, how they say like learn it, do it, teach it type of
Yep.
thing. It is because you like all of us, when we sign up to be anesthesia providers, like we are also educators. We are also teachers. Like we have to be able to educate people. So like it is good practice, you know. So the other day I took the time to a medical, she's never intubated before. So we got the gyroscope. We were able to see so she could better visualize all the structures and like it was a good teaching opportunity. You know, and yeah. And I still did the intubation, but at least she got her hands on and, you know, was able to identify and all that stuff. So it's not, we're not competing though.
National does have ACT sites,
Yeah.
but they focus on independent sites. I
Yeah,
think it's good to have both. I think you
Mhm.
know, I want to go to an
a
ACT
taste of
site
both.
so I understand what that's like, and I know. I just know I don't want to work in one, but I think it's still good for me to go to one. And you know, I think that the rhetoric online is louder than it really is. I mean, I've met a few physician anesthesiologists. I actually have a really good mentor who's one, and they don't feel the way that a lot of this rhetoric online is. Because anyone who's not a jackass knows that there's a huge anesthesia shortage that's coming. There already is one currently. It's gonna
The,
get worse. The baby boomers are getting
the
older,
baby
like,
boomers are, yeah, I was gonna say that.
and we only have what 100,000 anesthesia providers in the U.S. if you count both physicians and CRNAs and AAs. So you know, with a 330 million population, there's there is no threat to their job. Like they think there is these people online, but there's not. So, um, and you know, it's just a lot of online rhetoric. I would say to the people who are discouraged by that, because I know even I do sometimes. I read these things on Reddit and stuff. It's hard to not feel discouraged sometimes because a lot of them talk us down, or you know, you guys are technicians. You're not people who should be even learning medicine, or you don't know medicine. Um, you know, that's not the majority of people out there. It's just not. There's some loud minority online as usual, and it just is the way it is.
That's the beauty of this country.
Yeah, everyone gets a voice. Doesn't mean you're right. I think a lot of those people are jackasses, but
That's
they
that's
might
the
hate me
beauty of
too.
this country.
It's
That's the
fine.
beauty of this country. So, any particular specialty though that you guys want to work in? Like, do you like any particular specialty that excites you?
Oh, I started to hate when I first started doing like the neuro and spine cases. I was like, oh my God. But I actually quite enjoy them. So not to say that I would do it all the time, but I had a good teacher. Like if we're talking about MDAs, the MDA that I worked with had worked, you know, 26 years just as a neuro anesthesia provider. So like I was learning from someone who was
Yeah.
amazing. So I think that also had to play into it. But I mean, I love regional. Um, I did some OB. I don't think I could do it. I could definitely not do it full time, but I definitely want to incorporate it into practice just to not lose it. But
Mhm.
yeah, I don't know. We're still so
Yeah.
green into
Yeah,
this.
we're
There's
fresh.
still more to look at. Yeah. Good to know. What
I
about you?
think pain management would be fun to do at some point. I'd like to do like a fellowship in that.
You know, one of my buddies, James, Captain
Mhm.
James Winter,
Hmm.
he's a big thing in diversity, but he did that.
It's
It's like
something
a
that's
couple
gonna
years. Yeah, it's gonna
just
boom up later on.
yeah, it's gonna
Yeah.
continue to get larger. We need it,
Yeah.
and you know, like she said, regional. I mean, that's
That's the future.
yeah,
There's a
it already is.
present
Like
and future. Yeah.
I haven't done a single. I think I've done one total hip without doing a spinal. You know, almost all of them are done with that now, including and a block. You know, as well. Um,
Yeah.
it's
Regional
almost
is a
unheard
really
of.
good skill to have. Do
Yeah, that's
it.
why it's unfortunate that a lot of these schools don't teach that to CRNAs because we're going that direction. Like that is the new direction that we're going. Now that we have, you know, most places, ultrasound's so accessible now and
Well,
whatnot.
and to bring flight back into this, like that's another thing that like we used in flight. Not so much we didn't do regional anesthesia, but we used the ultrasound. Like we did fast exams, we did rush exams, like we were taught like so we already had the hands-on skills for that as well, and that
Before.
just translated
Yeah.
uh
Yeah.
even
I
more.
didn't. My flight company was ghetto, but we weren't that cool. But
You guys have
that's
Yeah,
another
blood.
thing that a lot of people try to hold. You know, we did have blood
Yeah.
eventually. But yeah, I mean, it's you know, my buddy who graduated from a Boston program, he's you know who he only did ACTs like for his clinicals. I think he said he graduated doing what did he tell me? Like 30 or 40 blocks. That's it. I'm already at 70 or 75, and I'm at 3 months. He
Wow.
graduated after all 3 years in an integrated program with only like 30 or 40.
So
Because the ACT models don't want to teach it. They want the physicians doing it.
yeah, we do
Next
get a lot
question,
of
Turnji.
no, we do get a lot of numbers. I was reflecting on that. God,
Are you reflecting? Okay.
I was reflecting on that. I was reflecting. You said something very
I'm
deep.
reflecting on how my Botox is wearing off and my eyebrows look crazy.
Oh my God.
Need a new
Because I'm
Botox.
from California.
Right, right. You have to have Botox, man. What are you talking about?
Yeah, I need to get my teeth bleached too.
It's a necessity. So, any kind of advice you would give for a few, current flight nurses who are seeking this path, or any kind of misconception that you heard when you were applying that you want to address? Or one piece of advice.
I would say specifically for flight nurses, I think that we just get so discouraged and like, you know, you can't it's easy to just say like, oh, like I'm probably not gonna get in, but you need to just try. And if you apply and you don't get in, then you have your answer. But like at least and that's what I told myself because I got to the point where I was just like, okay, I could fly for the rest of my career. But it's really demanding. It's really taxing. Me and Cam both have hearing loss.
Thanks.
Like, and that's real. That's true life. So like, what would that look like, 30 years from now? I just don't think that like it would be very sustainable. So I could have done it, but I was like, I'm gonna apply. And if I don't get in, I have my answer. But if I do get in, like look at what happens. So like you can't just write it off, apply, set yourself up to have the best chances of getting in. And just like believe in yourself. That sounds so dumb, but
Just have
like,
faith and
you
do
know,
it. If you don't apply,
yeah,
it's a
just
no.
do it.
Anyway, yeah.
I agree. Yeah. Nice little. The more you know.
Yeah.
No, I agree. Like she said, we both loved the job. I loved it. There was no reason for me to leave from a satisfaction standpoint.
Yeah.
You know, flight in California at least pays much less for nurses. It's highly competitive, so it's very hard to get into. It's a very small pool of applicants. Um, Funny enough, like to become a flight nurse, you have to have 3 years of critical care experience. You don't even need that to go to CRNA school. Like
Crazy.
Yeah.
literally, you can't even apply to be a flight nurse until you have
Yeah.
3 years of level 1
Certification.
or 2 ER or ICU.
Yeah.
Like, um, so we work really hard to get to that point. So it's
Mhm.
hard to give that up. And so I think same thing with me. Like I was in a job that I loved, and so I said, screw it, I'll apply. And if I don't get in, I'm still in a happy
Yeah.
place, which was great. But like she said, sustainability wise, like my body's messed up, and I didn't even do it. My neck's messed up, my rib. I have a lidocaine patch on right now from an injury that I got during flight. Like seriously, like it's ridiculous. And I'm a pussy, but like it is what it is. But got some workman's comp out of it. But this sounds stupid, but
Battle
it's a,
wounds. They're battle
it's a,
wounds.
this sounds dumb, but it's a job where you can die. We both know people who have died
People
in
have
this career.
died. People have died. No,
Yeah.
yeah.
We
Yeah. We
both
talk about it
personally know
lightly, but
people who have died. It happens much more than people think. I think we've had 2 crashes in my
Yeah.
company specifically this year that resulted in fatalities. So it's kind of a numbers game too. The longer you do it, the more
Probable.
likelihood
and I
that you're
don't
going to
want
be
to
in an accident.
I don't want to throw complacency in, but it is a
You
real
get very
thing.
complacent in that job. You do because at first you're excited and it's a lot of adrenaline
It
and you're
goes
paying
back to the
attention to
safety, like what I was
everything.
talking about. We are involved in the safety aspect. We are part of the flight crew. So like we play an important roles not only in the medical, but also like when it comes
Safety.
to aircraft safety.
Yeah, and then you get complacent, and it is
Like the perfect
um,
blend for anesthesia provider.
yeah. Well, I used to joke I would never do that job if I had kids or something. Like I would leave. Like
Yeah,
because
it's
it's
tough.
just doesn't pay well enough
Are you
to
having
the
kids?
risk versus pay benefit wasn't worth it to me. I made that analysis. I was like, as stupid as that is, my life has some type of monetary value, and I was like, this isn't meeting that. the risk. You know, if you're a firefighter, you have risk, but at least you're working for the government. They'll pay your family out and stuff. Your flight company is not going to pay your family out. Like they're not. Like they're private. They're not government. So unless they sue and they win, which who wants to go through that? And like these are ideas you have to think about when you're a flight nurse. You're like, I'm gonna every time I went on a flight, I'm like, this we could die, which is stressful. It is a little bit. That sounds like a lot of flight people would be like, "Ooh, what are you? Who you're just being
No,
a
but
bitch."
there's
Like
things that you can't
you
control.
think about it.
You can't control the weather.
You can't control a bird who's not gonna give
Yep,
you
you
away.
can't control a
That just
bird.
happened. I mean, a bunch of they were flying at night and hit a ton of birds, and
Yep.
they did everything right. It's just
Yeah.
shit happens.
Mhm.
But yeah, I think advice wise, a lot of people feel like they don't have you have the skills. Like in
Yeah,
flight, you
100%.
learn so many of those skills, and whether a school wants to see that or not, a ton of those skills are translatable to this field, like to CRNA. Whether it's
And
time management,
I don't think we mentioned though
education,
either that McKinnon he was a flight nurse. So like that gives that perspective. So
right?
an assistant program director was a flight nurse. So he has that experience and has in like relation to that.
I didn't know that.
Yeah.
hmm
Good to
I
know.
think
And he
Martin.
has the same background as me and Cam. So he was a paramedic, ER, ICU flight.
Yeah. I will say what we do learn that ICU nurses don't learn as much that I'm surprised by, and you can confirm this or not. I was ICU for a little bit, and I know it was true for me at least. They don't learn ventilators very well. I don't know if you like managed ventilators at all in your ICU. I did in Kentucky a little bit, not a lot, because I was ER, but I saw them.
I think
But
it comes down to resources and roles because
Yeah.
at least at Mayo Clinic and Kaiser, they're so big on patient
well, they're
safety.
union,
Yeah,
so they're like,
union,
do
patient
not touch the
safety,
ventilator.
advocacy, and we have providers like RTs take care of that. So it's like their game. Like they
Yeah,
don't touch my drips, I don't touch their vent.
Yeah.
yeah, and
I
I
know
worked in
how to give.
ICUs where
Yeah,
I would titrate the vent and tell the RT, and they would be thankful. And there was a few times I did it, and they're like, "Don't ever touch my vent again."
yeah.
Like, and I'm like, I was just trying to help, man. Like, or I BiPAP would get ordered, and I would start it for them. I'd go to the RT room and get it. And they'd be like, "Dude, thanks so much. Like, how do you know how to do that?" And I'm like, I just know how, like from flight and stuff.
I
But
just
like,
know how to
well, I just learned. I was born knowing.
do.
No, because of flight, like I've learned, or
Well,
critical care transport. But I think
and
she'll
Cam and I,
agree. Like when
well,
we learned
yeah.
later, when we were learning our ventilatory settings in school, like her and I were dialed. We already knew. I already knew the form. We were teaching the formulas. I think at one
Yeah,
point. Like
because it is confusing when you don't like, yeah, and you're not putting it to practice because you're in a sim lab.
which
It's
is
not like you're
almost
doing it
impossible.
on a patient. So like, and they don't, and this is just a critique. They don't teach it like they do in flight. Flight, it's because we're actually like,
Using the mode and settings to titrate for a patient's effect.
and
Whereas,
Cam and I started flight in a weird time because we started what in 2019.
yeah,
So
2020, 2019, yeah.
just prior to COVID, and then having to work a ventilator independently during COVID. So that
Yeah.
also was tough.
Yeah, I mean, I learned how to do it when I was on the ground because I did it on the ground. We did a lot of like, not, we did some critical stuff, but a lot of it was like nursing homes and stuff. And they're on vents chronically, but you still need to know how to titrate settings and how to initiate the ventilator management and all this stuff, which was really helpful because I would say that, and I don't think it's a national problem because I've talked to other people, they just, the depth of knowledge on ventilators for nurse anesthesia and even anesthesiologists is not very deep. Like they're like, hey, pressure control, assist control, spontaneous. Those are your settings. Just stick them on whatever and make sure the CO2 stays between 35 and 45 and you're good. Like, that's about all they teach in it. They don't even teach you ideal body weights and how to titrate that and stuff, really. Um, whereas that's like all we did. Type like they were very strict on that stuff for whatever reason, but very strict on it because we're only with them for like an hour. I think that helped a lot. I think that was like a huge thing that helped a lot. Because even now I'm like teaching some of our providers on how to do certain ventilatory management because they're like, I never got taught that. Like, so I think that was helpful too.
Yeah, I was talking to Dr. Lees the other day, and he was telling me that that's one of the feedbacks that they had heard from your guys' cohort regarding brushing more on the vents.
I think it
Yeah.
was just glazed really quickly,
Well, and it's more so because, like, I think once he got to emergence and titrating the vent, that's where, like, people
Yeah,
got lost. Because it's the titrating and getting someone from being ventilator dependent to spontaneous.
gonna
That's
take
You
a
a
got so
sec.
much
finesse.
editing to do, man.
I got
Oh,
so much.
sorry.
Once you got what? We lost
So
you. We gotta go back.
once, once you're like emerging someone from being ventilatory dependent to spontaneous,
Yeah,
like that's a finesse. You need like titrating a vent is finesse.
Which we didn't learn in flight because we don't take
Yeah, no. We did
that
not learn.
is, you know what? That was
That's the
one of the
hardest
questions
part.
was what's really maybe that was your next question, like what's
Yeah.
very difficult maybe. And I would say as an ICU nurse especially, and as because I mean sometimes you'd extubate in the ICU, we did sometimes, but we
yeah.
weren't really part of it. RT did it. But I mean, even in flight, we're putting people on the vent.
We're
Like
not taking them
We're
off.
intubating them. We're not
generally
taking
they're
the
still
tube out.
paralyzed. Um, I never extubated anybody in my
Yeah,
life, like, and I
yeah.
have never weaned someone off a vent unless
No.
it's very slowly. And like in ICU, they're so protective about it. They're like, okay, like they didn't do more than 10 minutes
Pass,
today, and
have
their
to pass all the
yeah,
protocols and
their
equipment.
volumes
Yep.
weren't great, and they won't
Yeah,
follow commands. So nope. Like in anesthesia, we're like, cool, they took a breath, pull, like, but more finesse than that. But it's
Yes.
just something that I
we
never
deflate
learned.
them out.
It is completely.
I think it's something that makes more sense once you're in clinicals,
Oh,
once you start
it
doing.
makes way, but it's so foreign. Like I didn't know. Like I'm still. They call it the art of anesthesia. It is definitely like learning how to emerge a patient. I think is the hardest thing.
It is.
Well, learning how to emerge them smoothly.
Yeah.
Um, I can emerge them. It's just not always smooth.
No
But
spasms.
I think that is one of the challenging things for me, at least, is emergence, and I think it is for a lot of people. But it's completely foreign to me because whether I worked ER or flight, we put them on it. We never even considered weaning them off of it.
Yeah.
So it's new to me, and I like it. It's fun to learn something that most of the stuff I'm learning is new to me, but I can tie it into things. This I can't tie into anything.
Okay, so before we end this podcast, one piece of advice, anything, could be anything, could be life advice, could be drink more beer, not drink beer,
Number
whatever
three,
it is. That's what I'm saying. So any kind of advice.
it's only
You
because
guys,
it's the weekend. I had
why
to make
not?
up for the whole week.
Why not?
I think that the only limit is yourself. You're the only one limiting yourself. So don't let that be the case.
Right in the heart.
Yeah.
You're the only competition.
Yeah. And
Well,
that's
like
so
Unless you're
true
up
when you
against
get into
Terranjeet,
school.
then
that's what
you're not. If you're up against Terranjeet, give up. Just drop it
Give
all.
up.
Don't even try.
Nah, bro.
He pops up with that epic stash and beard and his stories. You're not getting picked.
I'm
True.
blushing. Brown, you got a brown guy blushing, man. Wow.
After we interviewed you that time and we hung up, we were like, well, he's getting in
Yeah, we're like, girl,
Wow.
this is great.
with your story. I was like, I don't even care if you made that up. It was so unique and good. I'm like, he's getting in, fucker.
Yeah,
Just kidding.
he did great. He had a great. We did a mock interview for him. He was great.
That was
I
awesome.
mean, he was already
I'm actually
good.
mocking a couple of people right now, so passing it on, and I'm hoping they get in.
Yeah.
This quarter, I mean, this year the competition is really high. Well,
Yeah,
apart
It's
I
from
have
getting,
I
it's
have
getting
two
more and more.
flight nurse friends. I have two flight nurse friends who are applying this cycle.
wow, I wish them luck. I just
Yeah,
feel like the more people are figuring out about National University, the more people are
it's
applying.
spreading.
It's spreading the word of mouth and stuff.
Hmm.
Yeah. I
Yeah.
will say, like, I didn't know anything about the program, like a lot of people don't. You know, I think there are pros and cons with every program, and there's good and bad, and there's definitely bad things about National. There's definitely good things.
Yeah, the
Um,
grass isn't greener everywhere.
just like every program on Earth. Not everything's going to be 100%, but I will say I am very glad I ended up in a program whose priority is both regional and whose priority is independent practice. Um, those two things I'm very happy about because
And
I
you're
personally
being
find independent practice very important to me.
Yeah. And you're being taught by anesthesia providers who are still practicing day to
Yeah,
day.
they all still work, which
Yeah.
is also a downside because they're busy and they don't get back to
Yeah.
you.
But they're very knowledgeable.
They're very knowledgeable.
And the first year is hard because it's just grind, 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 learn, learn,
Oh,
learn.
right, yeah.
Yeah.
But
And
it's
I
worth
think that
it.
would be probably some of my advice is to know that a few things. Like if you do apply and you get in, stop working like 3 months prior to getting in. Like,
Take
do
a
not
break.
work up to the date that you start. Don't freaking do it. Take a vacation. If you have
Enjoy.
family and kids, take them with you and spend time with
Yeah,
them.
don't do what me and Cam did and work till the last possible
Yeah,
second.
I don't have anyone that loves me in my life. Like, that's why I act.
Yeah.
So, like, I didn't
I
need to
love you,
spend
bro.
time
What
with
are you talking about? I love
one
you.
person who I didn't know at the time.
I
So,
don't.
like, I didn't have anyone to spend time with, so I worked up until the last minute. I did go on a Actually, I went on. I made up for it the next year. But like,
Yeah, you
take.
went to all Asian countries.
I went to
Yes.
Thailand. I went to
He goes on
Vietnam.
tons of trips. But that's also important too, to take
But she-
time for yourself.
Yeah.
There
What
she
she's
goes.
gonna say is take the time to go
Take
do something.
time, take the trip, have some
Yeah.
fun. I think that's what she
We'll
means.
start right now. Ready? There we go. See, shaking her head.
Oh, yeah, she agrees.
Yeah, don't work up until the last day, though. I know that there's money to be made and you need to support your family and stuff, but I mean, even if you have kids and a wife, you need to figure out how you're going to do that for 3 years without an income. So you should probably be able to take 3 months prior at least and do something for yourself, spend time with your kids and your family or just yourself even, and decompress prior to the real shit because it's going to be, as you can attest, especially the first year if you're a front-loaded program, it's going to be nonstop. Like you're not going to have a lot of chances. We took time to go study at a bar every once in a while and stuff just to feel normal, but which is important. But you're not going to be able to live the life that you're living, that you were before. So like, it's a sacrifice. I think that my biggest advice is just prepare by relaxing and chilling because people will message me like who got in what like July or something like right when they applied and they're like, so like I want to start studying now. I want to get some books. I'm like, no, do not.
Karen
do
G
that.
knows.
I know.
Enjoy it.
He's one of those people.
All there. We were all there.
I wasn't. I didn't even. I'm a slacker. I literally
I was
did
more
not
worried
even
about
look.
financial aid.
I didn't even know about the financial aid till Caitlin told me about it. I was already in the program, and
I was like, you
I
need to
didn't even.
apply for FAFSA, bro.
How
Yeah,
are you gonna get your money, bro? How you
dude,
gonna
she
get
had to
your
teach me how. Literally,
It's like, what do you mean? Like, what do you mean? What do you
I'm a
mean?
lucky person. I always find some women in my life who will take care of me in some way. Caitlin is one of those people who is like a great friend and will do that. Thank God. There's always someone out there who will take me in like a deranged rabid raccoon
Yeah, he
who
needs to
they
be
want as a pet.
caged, medicated.
Yeah, and they'll medicate me and they'll try and then I'll just
Funny story.
but like
A funny story. I was asking Caitlin about what's gonna work, and Cam is not responding in the group chat. So what should I do? She was like, you know what? Don't ask him to respond. Just
Harper
tell him
course.
a
He
date.
said, tell him a
Just
time and a place.
just tell him a time and date, and he'll
He
just show up. And I was like,
scheduled like my whole first year for me. Like literally. My girlfriend will literally message her,
Yep.
be like,
Where-
what's the schedule like?
She'll be like,
Because she
hey,
won't
what's
ask me.
the
'Cause
schedule?
I don't know. I have no idea. I don't even know what our next break is. I have no freaking clue.
Don't worry, it's not till Christmas.
It's not till Christmas yet.
I don't know. Oh, really? We don't get one between this next one again?
No.
Lame. Yeah. So my advice is find yourself a Caitlin who will take care of you.
All right.
Or somebody.
Yeah, you'll be very
Have a
close to your
wife.
classmates.
Yeah. Find a study group. I mean, I don't know if you have. I'm sure you have one, Taryn G. But a big group doesn't work.
No.
It doesn't. I don't know how big your group is, but like I know at the beginning of our program, everyone tried to like do these like 10-person groups. I tried even, and I was like, no, this too many cooks in the kitchen. You need to limit it to like 3 or 4 people, like max,
That's the sweet
who
spot, yeah.
have similar study habits or ways of doing things. Otherwise, and thank God I found them because I'd be screwed. Like seriously, like they helped me get through this program because they kept me on track. I learned so many study habits from them that I doubt they learned any from me. I did make them go out and have beers and like
Yeah.
do things in more
And
social environments,
Cam's really good at drawing, so we always had him draw things on the board.
which helps nothing at all in anesthesia school, but it helped them.
It helps,
So yeah,
man. If you know how to rub brachial plexus, it helps a lot.
I can do that. I don't know how that's going to be helpful, but
Randy Travis drinks cold beer.
He
yeah,
does.
exactly.
Marmu.
You'll never not have to learn the spinal cranial nerves.
Oh my
Every time.
God.
I've learned it 6 times in my life now. And it just keeps coming back. High school once, undergrad once, nursing school once, here a few times. Just, it doesn't go away.
Well, I want to thank you both for coming out here today and sharing your story. I like this. This was not even like an interview, not a podcast. It was very fun.
Oh, yeah, no, you're
'Cause
not
we're
going
Like,
yappers. We love to
to beat the
talk.
fuck
I
up.
like that. I hope you guys had some fun out of this, and I hope the people who are gonna watch this can get some insight. And it's not that tough. Well, it is difficult, and it is
It's
difficult for a
doable.
reason.
It's
It's
doable.
it's difficult for a reason, but as you say, it's doable. And
It
at this
should be
point,
difficult, right?
it should be
Like,
difficult because
If
you
it
don't
weren't
want
difficult, then everyone would do it.
exactly my
yeah.
point. So
And I
yeah,
will say, a lot of people want to do it right at 1 year. Like, you get 1 year of ICU, but just because you have, like, her and I have almost a decade, right, before we did this, and I'm glad I did. It sucks that I didn't start earlier, sure,
Yeah.
but I'm glad I have so many experiences and
yeah,
opportunities and knowledge to draw from because it does. Every day there are things that happen where I have knowledge that I can utilize that a lot of these even CRNAs like done do a lot of peds and I've done a lot because I did ER. So like the other day I was like, hey, why don't we try intranasal Versed? And the CRNA's like, I've never done that in my life. Is that even possible? I'm like, yes, it's possible. Let's do it. I'll show you. Like lots of I think having at least personally if it was me, I think that you should have to have 3 years of ICU experience or critical care experience before you can go to CRNA school. I know that would suck for you, Tanji, because you're Mr. Young Guy over here, but like there's so many things to learn, and 1 year is not enough. You're still getting your feet wet as a nurse in critical care. Um, there's so much you don't know. At 1 year, I knew nothing. I still don't know anything. But like at 1 year, I knew like fuck all. Like it took me to like year 3 to really start getting a grasp on the critical care things I was learning. So, you know, and that's
no,
what's crazy to me. Flight requires 3 years, but CRNA school requires one. It's just it kind of blows my mind. But um, do yourself a favor and have at least 2 because I think that will be helpful in the long
I think
run.
I think by the time you're applying and you're like set application, if you have like 2 to 3 years, I think that's a good number. But not
Yeah,
to
because like
discourage to anyone who's applying with 1 year, because I feel like that's the beauty of this program. And diversity is just not how you look or how I look. It's
yeah,
diversity within experiences. Someone is with 10 years of experience, flight nursing, and someone has just graduated
all
nursing
different.
2 years ago. So we both learn from each other. So
Yeah. Well, and how you were a new grad ICU nurse, right?
yeah,
Yeah, like how long was your orientation or your like
12 weeks.
yeah,
That's
well
the
you were in Midwest. That's what they do there.
that's the
You're lucky
average.
it wasn't 3 weeks.
Yeah, some of the places are a lot
Some
longer.
places on the West Coast are as long as 6 months. Like
Yeah.
they'll train
Oh yeah.
like so it's like if you apply at 1 year, you have in reality 6 months on your own.
Yeah.
And
Like
then in the beginning, you don't even get the sickest patient. So yeah.
Yeah.
no. That's why I say do yourself a favor and have a good foundation of these drips and how they work and what medications, because it will be harder for you at the beginning to learn all that stuff if you don't have a good foundation of it.
And
You're just,
which is, you bring another point. If you are someone who is like that at that stage, who's like graduating from high school and who already know that you want to be a CRNA like I did,
yeah,
this is a sign for you to not screw around or waste your time in undergrad. So you can finish it ASAP. So you can maybe give yourself 2 to 3 years in the ICU, right?
right.
Because time is time. You can
Yep.
summer classes,
Yeah,
whatever you want, you know.
yeah. That's my number one regret is not knowing what I wanted to do and focusing and honing in on it. And I think
Yeah.
that's pretty much every adult's right. Like
Yeah,
we all make mistakes when we're 17 and 18. If had I known where I'd
how
be
you
now,
learn. That's how you learn. Your frontal
yeah,
lobe is
the
not
best
developed until you're 25.
the best learning is
This is
experience. It really
true.
is. So
Mine just developed like 3 months ago.
mine's not developed at all, and I keep inhibiting it with liquor, so it's never going to develop. Uh, but yeah, I mean, it's if you, I think having that goal, and if you think it's not, I think what's great about Caitlin and I is that we are not stellar students, or we weren't. We are now. We have straight A's now. Seriously,
Yeah.
like her and I have almost a 4.0. If you
Yeah.
would have told me that 5 years ago, I would have laughed in your face. There's no freaking way that I would ever be close to a 4.0.
So it doesn't define you.
Oh, it
You
doesn't.
can turn it around. It will take work. You're going to have to sacrifice. You'll have to redo courses. Whatever you need to do it, it is possible. And it'll add to the story that you have to give to somebody and be like, hey, I overcame all this, and that's how badly I want it. I want it that bad that I did screw up and I had bad grades, but I didn't care. I was going to show you that I'm better now and that I'm going to fix it. And, you know,
And I
that's
did
why,
it.
you know, getting a straight A's in CRNA school isn't that important. I mean, you need to pass, but to me, it's important because it shows that I've grown and that I've learned and that I can do it. Like, and I'm like,
And
yeah,
then it gives
straight
you
A's.
it gives you a very big cushion when the final comes around, and you have to cram all that stuff into your head. If you have
Get
maintained
a
like
really
an
good
A,
grade on that first exam.
yeah, you really need
I-
to do good.
At the end of my first year, I printed out my transcript that had straight A's on it, and I'm 32. I walked into my parents' kitchen while they were both standing there. I was like, look at this shit. Look at that. See that? Straight A's. Fuckers. Because they always used to give me shit because my grades are
Look at
crap.
this.
And
Look
I
at
was
this.
like, hang this on the fridge right now.
Wow.
At 32, I don't even live here. It's going on the fridge.
You better send it to every family group chat out there.
That's right. I was like, it's still on the fridge to this day. They like circled it. I'm like, that's right.
Well, thank you both again for
No
coming on.
worries.
Thank you.
Really
We
appreciate
look
it.
forward to never being invited back because we're complete assholes. And
No, that's not the truth. That's not the truth.
Uh,
That's not the